Tuombe. Ewe Mwenyezi Mungu ambaye kwa hekima na wema wako umeteua nyadhifa za viongozi na mabunge kwa ustawi wa jamii na utawala wa haki wa wanadamu. Twakusihi ututazame kwa neema nyingi sisi watumishi wako ambao umeridhika kutuita ili kutekeleza shughuli muhimu za jamhuri hii yetu. Twakuomba ututeremshie baraka zako sisi tuliokutanika hapa na utujalie kuyatenda na kufikiria mambo yote yatakayofikishwa mbele yetu kwa njia ya haki na uaminifu, ili utukufu na sifa zako ziendelezwe, na ili kustawisha amani, ufanisi na heri ya nchi hii yetu, na wale ambao haja zao umezikabidhi mikononi mwetu. Amin. Next order.
Order number 1, administration of oath.
Next order.
Order number 2, communication from the chair.
Honorable members, I recognize 54 students from Orine Primary and Junior School from Baringo County who are accompanied by their teachers, namely Mr. Musa Mulatit, Mrs. Eunice Budotich, Mr. James Kiptun, Mrs. Leah Cheriot, Ms. Cynthia Kirui, Mrs. Kola Keter, Mrs. Nora Kiprop, Ms. Evelyn Koech, Mrs. Sarah Mendoa, Mrs. Cynthia Togoch, Mrs. Eunice Chelagat, Mrs. June Talam. In our tradition of recognizing and welcoming visitors, I take this opportunity to welcome you all to the County Assembly of Nakuru. Karibuni sana. Next order.
Order number 3, messages.
Next order.
Order number 4, petitions.
Next order.
Order number 5, papers.
There are no papers to be laid. Next order.
Order number 6, notices of motion.
Next order.
Order number 7, statements.
There are no statements. Next order.
Order number 8, motion.
There is a motion by the Honorable Chairperson, Committee on County Public Funds, and that is Chairperson, Committee on County Public Accounts and Investment, the Honorable Simon Kamau.
Thank you, Mr. Speaker, sir. I take this opportunity to thank you and the honorable members, of course, for the support they have given me and my committee on Public Accounts and Investment Committee when we were doing the interrogation of this particular facility, that is specifically Njoro Level 4 Hospital. Mr. Speaker, on behalf of the members of Nakuru County Assembly Public Accounts and Investment Committee, I beg to move the adoption of the report of the committee on the report of the Auditor General on the financial statements of Njoro Level 4 Hospital of Nakuru County Government for the year that ended 30th June 2023. Mr. Speaker, I want to go straight away to the mandate of the committee, that is Public Accounts and Investment Committee, and this committee is mandated to do the following. 1, examine the accounts showing the appropriation of the sum voted by the House to meet the public expenditure and of such other accounts laid before the House as the committee may think fit. Number 2, Mr. Speaker, the committee is also supposed to examine the reports and accounts of the public investments. Number 3, it's also supposed to examine the reports, if any, like the one I'm holding here, the Auditor General report. And number 5, examine in the context of the autonomy and efficiency of the public investments, whether the affairs of the public investments are being managed in accordance with the sound financial or business principles and prudent commercial practices. Mr. Speaker, in as far as the membership of the committee is concerned, I believe all the honorable members and you, Mr. Speaker, have the membership of this committee, of course, led by I, myself, Simon Kamau Karanja as the chair, then Honorable Michael as the vice, and of course the list continues all the way to number 13, which is closed by Honorable Gadoita Mwangi. Mr. Speaker, in our workings and undertakings, the committee is faced by various challenges, and of course, key among them is that these members of this committee noted that the time and resources that are allocated to this committee are too little in comparison to the workload that is before this committee. Mr. Speaker, I know we have been trying to address this issue, and very soon, maybe this one is going to be a thing of the past, because of course we are in a consultation between the committee and your office to see how this one is going to be resolved. Because of course, it is true, the committee has a lot of work to do. Sometimes, Mr. Speaker, and you are aware of this, and of course we requested for permission from your office that we be allowed to be coming even when the other honorable members are at home, so that at least we can try and expedite some of these workloads that is before this committee. Number 2, also, Mr. Speaker, is that, and of course this is a major challenge, and I think we are going to still sit with the honorable member for Turi, the Honorable John Mwangi, so that we can be able to see some of these recommendations that we make as a committee are implemented on time. Because if we don't, then even people outside there, example some of these management of these facilities, they will be knowing our issue is only discussing and giving recommendations. But of course, when it comes to the implementation part, it becomes a challenge. So I'm begging also Mheshimiwa John Mwangi from Turi to make sure that the recommendations that are put forward by the committee are implemented, so that at least when we do this, at least we are going to close some of the gaps. And of course, when we do that, we are going to increase the efficiency in some of these facilities, which will translate to better performance and good service delivery to Wanjiko. So therefore, that is also another challenge. And luckily or unluckily, I'm still a member of the implementation committee. So we are going to consult as the 2 chairs, and we chart the best way forward. Mr. Speaker, the committee proceedings, we are saying the committee held sittings on which it closely examined and had evidence from the management of Njoro Sub-County Level 4 Hospital, and in its inquiry into the audit response of the hospital for the year that ended 30th June 2023, the committee had both oral and written evidence from the Njoro Sub-County Hospital management. The records for the same adduced documents and notes received by the committee form the basis of the committee's observation and recommendation as outlined in the report, and can be obtained in the Hansard reports of the committee available in the County Assembly of Nakuru. The major objective of this particular committee, that is County Public Accounts and Investment, is that the observations and the recommendations, if taken into account and implemented, and of course in good time, this will enhance accountability, effectiveness, transparency, efficiency, prudent investment, and financial management in all level 4 hospitals in the county government. Mr. Speaker, the following are some of the facilities, both level 5 and level 4, that are within Nakuru County. One, we have one level 5 hospital, that is Nakuru Provincial General Hospital, and of course the list continues of the level 4 hospitals that are that have attained the status of level 4 hospital. This includes Moro Sub-County level 4, Njoro Sub-County level 4, Meroge Karaoke Sub-County level 4, Bondeni Sub-County level 4, Bahati, Kabazi, Subukia, Gilgil, Naivasha, Soin, Elbagon, and Annex. Those are some of the facilities that, of course, have attained the status of level 4 hospital. But, Mr. Speaker, when we are interrogating some of these facilities, we are noting that, I don't know, for whatever reason, some of these facilities acquired this level 4 hospital. Because if you see the facilities and the personnel, in fact, you cannot compare. It is not anywhere near that particular facility to be referred to as level 4. Example, we have Soin. Another one, we have Subukia. Another one, we have Orengoroni. Some of these facilities, Mr. Speaker, sir, they don't even need to be referred as level 4 hospital, because they are those services that are supposed to be provided by level 4 hospitals. But of course, based on the infrastructure, and of course, maybe the personnel in these facilities. If, for example, a facility requires about 20, or even 75 nurses, Mr. Speaker, and the only available nurses are 6, then it means automatically the services for the common mwananchi is going to be compromised. I don't know why they were raised to level 4 hospitals. I don't know whether it was for political reasons or whatever, Mr. Speaker, but of course, there are those facilities, and I'm humbly requesting, if there is anything that can be done by the Committee on Health, let it be done and be done soon. I request Mheshimiwa, maybe Chair Health, who is of course very competent in his work, either maybe to declare them, maybe or to degrade the facility to level 3 and level 2, because some of them even, they are supposed to be level 2 hospitals. If that is not the case, then the Department of Health should address this issue and increase the personnel as well as the infrastructure. So maybe either of the two, as long as we improve the service delivery to common mwananchi. Otherwise, we cannot keep on maybe calling some of the facilities level 4, and they are not supposed, or anywhere near, Mr. Speaker, to be called so, the level 4 hospitals. Mr. Speaker, there are reasons as to why this particular report, of course, the auditor had issues with level 4, with the Njoro Sub-County level 4 hospital, the management itself. And the reason as to why we have this report before us is because of the following reasons. One, we have what we call inaccurate total assets and liabilities. Mr. Speaker, when these people, and particularly maybe the accountants of these particular facilities, when they are preparing the financial statement, of course, there are some of the discrepancies that are noted year in, year out. I don't know whether it is by fault or by design, Mr. Speaker. Every time we give some of these recommendations, but of course, some of these discrepancies keep on reoccurring in these facilities, year in, year out. I don't know whether it is what I've said by design or by default, or else some of these accountants are not competent to hold these particular offices. And that is why maybe I'm requesting Mheshimiwa John Mwangi, we can be making after maybe the 6 months, the time that is supposed to, maybe this report is supposed to be implemented, we revisit some of these facilities to see if these accountants or whoever is concerned in preparing this financial statement, if that person is not capable of doing his or her job, then there are so many people in our republic who are qualified to do some of these jobs. Then they need to leave, and then we bring some competent people, so that at least some of these discrepancies. Imagine, Mr. Speaker, sir, Njoro Sub-County, a difference of about 2.6 million. That is a lot of money. If at all, maybe this money went into somebody's pocket, then automatically it translates. There is some services that were supposed to be provided by this amount, of which will not be provided because of maybe negligence, or maybe doing it by design, by some of these accountants. This is one of the reasons, and of course, this management, even when they sat before us, they were not able to explain these discrepancies. And that is why we as the committee, we had the following recommendations or findings and recommendations for the same. The committee had the following findings. One, that the management failed to explain the variance amounting to slightly over 2.6 million, between the statement of financial position, which shows the total net assets and liabilities of maybe slightly over 23 million. Whatever was accounted for was slightly over 20 million, therefore bringing about a difference of 2.6 million. Committee had the following recommendation, Mr. Speaker. One, or rather, had the following recommendation. The management should rectify the discrepancies between the statement of financial position and the statement of changes in net assets by ensuring that all capital funds and other balances are accurately reflected in the financial statement. Mr. Speaker, another issue that was there between the auditors and the management of Njoro Level 4 Sub-County Hospital is that there were variances in revenues from rendering of medical services. Mr. Speaker, before we have SHA, we had National Health Insurance Fund, that is NHIF. There is an issue between whatever NHIF management is saying and the facility, that is specifically Njoro Level 4 Hospital is saying. There is a difference. The management is saying that they are supposed to be given 10 million, 285,715, whereas the NHIF management is saying the money that is supposed to reimburse to Njoro Level 4 Hospital is 9,907,980. And therefore, there is a variance of slightly over 377,000, Mr. Speaker. This is a lot. It may appear a small amount, but of course, taking this, placing this amount to Njoro Level 4 Hospital, then, Mr. Speaker and honorable members, this is amount of money that, of course, can do so much in Njoro Level 4 Hospital. In fact, a hospital that personally I've visited, Mr. Speaker, and I want to, I'm seeing Mheshimiwa from Njoro, and maybe he can confirm this. Some of the very basic drugs, they are not found within that particular facility. What do you mean, Mr. Speaker? Personally, I went there, and Panadol itself was not available. Panadol itself. Then you can try to imagine 377,000. How many Panadols and penicillins can it buy? A lot, Mr. Speaker. Therefore, if these discrepancies and this gap can be closed, and of course these 377,000 is found, then maybe we can increase in one way or the other, directly or indirectly, we can increase maybe the services delivery within Njoro Level 4 Hospital. Mr. Speaker, on the same, the committee had the following findings. One is that a variance of 377,735 was noted between the National Health Insurance Fund, that is NHIF, reimbursement records, and the reported amount in the financial statement. The accuracy and the completeness of the medical service income could not be confirmed. And the committee had the following recommendations. One, the management should reconcile the NHIF reimbursement records with the financial statements to ensure that the revenue reported is complete and accurate, and provide supporting documents for all transactions. And I think, Mr. Speaker, we gave them maybe a deadline of about 6 months so that at least they can be able to reconcile the same and tell us maybe where the 377,000 is. Is it in their management or within the NHIF management? Number two, a progress report of the reconciled balances to be availed by the hospital management to the committee by 30th June 2025. Mr. Speaker, another audit query that was put forward by the Office of the Auditor General is that this particular facility did a non-disclosure of property, plant and equipment. This is a big problem, Mr. Speaker. For example, and I think we talked about this some times back, Mr. Speaker, we said some of the assets within the facility are not recorded at all. For instance, we talked of the land, for example. It is maybe the land itself is within maybe the jurisdiction. As we speak now, the owners of that particular piece of land is the Catholic Church. And I think we said this one needs to be addressed as soon as possible. Because at some point, the facility can be in good terms with the institution itself, that is the church. But at some point, nobody can say that at some point they will be in disagreement. The hospital and of course the church. If the church now today decides that they want to take their land back, automatically nobody is going to hold them back. Because of course they are the owners of the title deed as we speak. And remember, the county government of Nakuru, both the executive and maybe Mheshimiwa Hezi, are allocating a lot of money in that particular facility. So we are allocating money both at the ward level and at the county level, but of course to the land that does not belong to the county government of Nakuru. This needs to be addressed as soon as possible. Of course, there are so many other assets that were not disclosed. Mr. Speaker, the committee, on this one, the committee had the following findings. One, the financial statement reflected a property, plant and equipment balance of 2,460,173, but several assets, including the lands, buildings, vehicles, and medical equipment, were not disclosed. You can try to imagine if the land itself, maybe the buildings, and of course we know Joro level 4 the way it is. We have so many buildings within that particular facility. If they are not included in the asset register, then there is a big problem. If the cars, the ambulances that are within the facility are not recorded, then automatically this one, the figure that is given there, Mr. Speaker, sir, cannot be the true picture of that particular facility in terms of the facilities. Another finding, Mr. Speaker, is that the committee noted that the majority of the hospital's land was either donated or was from the defunct county council, and as a result, the hospital does not possess title deeds for these properties. Yes, we know it is not the prerogative of the management of that particular facility to provide the title deeds, but again, it is within the same county government where these title deeds are supposed to come from. And this specifically, the blame is going to the Department of Lands. And I think, Mr. Speaker, we said we are going to invite the CCM for lands as well as the management from the executive side so that they can tell us why. And mark you, Mr. Speaker, this is a problem that is cutting across almost in all the facilities. I saw a report from Mheshimiwa Njuguna, the chairman health. You can try to imagine, Mr. Speaker, if my memory serves me right, we had over 220 facilities, out of which about 6 or 7, or thereabout, are the ones that possesses these title deeds. Mr. Speaker, there is a big problem because we continue pumping money within the facilities that does not, in quotes, does not belong to the county government of Nakuru. Because the only thing that can, of course, claim ownership is the presence of the title deeds. Therefore, we are challenging the Department of Lands. We are challenging the Department of Land to ensure that this process of providing title deeds to the facilities is expedited. The committee, on the same, Mr. Speaker, the committee had the following recommendations. One, the management should ensure that all property, plant, and equipment are accurately disclosed in the financial statements with supporting documentation, such as valuation reports, asset registers, and ownership records, particularly for land and buildings. Number two, the CCM and the CO Department of Lands should expedite the process of valuation so that the hospital gets title deeds for the land. The committee recommends that a progress report from the department to be availed to the committee by 30th June 2025. Mr. Speaker, another query that was put forward by the Office of the Auditor General is the unconfirmed inventory balance. Mr. Speaker, sometimes the point that we have just finished, we have said there is no valuation report. And here, the management of maybe Njoro's level 4 sub-county hospital is saying some of these inventories, they did not do a stock take. They didn't. But of course, at the end, they are saying all these stocks is supposed to cost, maybe it has attached the value of 2,900,457. So the question that committee was asking itself, where did they get this figure from? Because the valuation was not taken, the stock taking did not take place at all. Then where did they get this figure from? So, Mr. Speaker, we can only, as a committee, can conclude that this is a cooked figure and something needs to be done. Because if the stock take was not taken, then where did you get this value for the stock itself? Where did you get it from? So, Mr. Speaker, on the same, the committee had the following findings. The statement of financial position reflected an inventory balance of 2,900,457, but no evidence of an annual stock take was provided. There was no evidence, Mr. Speaker, of any stock take undertaken during the period under review. And that is the question. If you did not do a stock take, then where did you get the 2.9 million shillings from? Where? So this is a cooked figure, Mr. Speaker, sir. The committee made the following recommendation. One, the management should implement and document an annual stock taking process to confirm the quantities, value, and status of inventory, and ensuring that the inventory balance is accurate and, of course, supported by appropriate documents or records. Number 6, Mr. Speaker, is that there was delayed completion of the outpatient and inpatient block. And we are saying the review of the hospital records revealed the construction of an outpatient block with a contract sum of slightly over 147 million that commenced on 16th February 2021 for a contracted period of 40 weeks, which wraps on 23rd November 2021. And maybe Mheshimiwa from Joro, Mheshimiwa Hizi, can confirm that this is true. However, during the verification in the month of April 2024, revealed that the project was still under construction with an estimated completion of level of 70%. In addition, the project was being constructed on a donated 7-acre piece of land, whose ownership documents were not provided for audit. So, Mr. Speaker, you can see the kind of risk that we are taking. One particular facility, only the inpatient and the outpatient block, that has been allocated slightly over 147 million. And of course, we are building it on a donated land. If the owners of the land can come today and claim their land, then automatically, this is a big mess for the county government of Nakuru and specifically to the people of Njoro. I'm saying this, Mr. Speaker, because of course I know the facility. Coming from the same sub-county, I know the facility. And having not been completed, then it means automatically, and this is where we need to plan and plan well. If the executive itself has decided that, of course, is supposed to facilitate the construction of such facilities, then we should try as much as possible to allocate money that is adequate from the beginning to the completion of such facilities, Mr. Speaker. Because you can try to imagine, if it is 147 million shillings, I can see Mheshimiwa Palanga here from Murukaria, who is a good mathematician. He can do this math and tell me 147 million. We have used 70% of the same amount. Maybe from 2021, and it has not been completed to date, then it means a lot of money has been maybe put to hold, Mr. Speaker. Because if it is not complete, and we know it because we come from this particular sub-county, we know there are no services that are being offered in that particular facility. So it is good, even for the county executive member, the relevant department, of course, to expedite, make sure that the remaining 30% is provided so that this block is completed and the services are going to be enjoyed by the Wananchi. And not only in Joro. Remember, this is a facility that is going to help maybe the residents of maybe Nakuru and even Bomet, Mr. Speaker. So it is that important facility, and this needs to be expedited by the department itself, because they are the financiers of this particular project. Mr. Speaker, the committee had the following findings. The construction project for the outpatient block, which began in February 2021, has not been completed, and is estimated at 70% completion as of April 2024. And in short, we are saying that we agreed, because of course we did our due diligence as a committee, and we agreed with the auditors, of course, what the report of the Auditor General was saying. So number two, the ownership documents for the land on which the block is being constructed were not provided to the committee. And on this, the committee made the following recommendation: that the accounting officer, Department of Medical Services, Public Health and Sanitation, to fast track completion of the stall project, and a report for the same be availed to the committee within a period of 90 days upon adoption of this report. Mr. Speaker, if maybe I can check this report. We read this particular report maybe sometimes in April, if I'm not wrong. So the 90 days is still elapsing. So we will still require to maybe invite the CEO, maybe and the CCM, to come and explain up to what level they have gone. And Mr. Speaker, another issue that was put forward by the auditors is that Njoro Sub-County Level 4 Hospital was engaging irregular engagement of cash workers. Mr. Speaker, these cash workers are supposed to be employed maybe on a casual basis for a period not exceeding 3 months. But of course, when the auditors and the committee sat down and interrogated the management of Njoro Level 4 Sub-County Hospital, we realized that there were some cashiers that were engaged even for more than 2 months. That this one is against the law, Mr. Speaker. And these cashier laborers, I said this when I was presenting another report, because this is a problem that is cutting almost across all the facilities. We said that these people, the cashier laborers, they are only supposed to be called when there is a need. Otherwise, they are not supposed to be there all the time, including even a period of even 2 years or even more. Because if they are there and their services is not required, Mr. Speaker, then it means the amount of money that they are getting, they are not supposed to be getting the money. The money is supposed to be doing something else, providing another service to that particular facility. And of course, there was this issue in Njoro Level 4 Sub-County Hospital. Mr. Speaker, on the same irregular engagement of cashier workers, the committee had the following findings. One, that the cashier workers were engaged for periods longer than 3 months, which is contrary to Section B16, Part 1 of the County Public Service Human Resource Manual. Number two, management was in breach of the law, the said law, Mr. Speaker. And the committee made the following recommendations. One, the management should adhere to the County Public Service Human Resource Manual and ensure that cashier workers are engaged for urgent, short-term tasks only, and for periods not exceeding 3 months, unless there is a prior approval from the County Public Service Board. Number two, County Public Service Board should ensure that hospital has adequate human resources, either by employing them on contract or permanent basis. Mr. Speaker, another risk that, of course, is posing on the same is that some of these cashier workers, if they are engaged for more than three months, then the terms of service changes from maybe short to long contract. And if you decide maybe to disengage them, some of these cashier workers can be able to go to the court. That if they go to the court again, of course, due to litigation issues, we are going to increase again the amount when, of course, we go to that particular route. And, of course, this money, again, is supposed to be doing something else within the county government of Nakuru. Mr. Speaker, this is also another issue, and a major issue for that matter, Mr. Speaker, is that there is deficiencies in implementation of the universal health coverage. Mr. Speaker, this is both in terms of infrastructure and in terms of human resource. And that is why I was saying some of these facilities, if properly looked at, if we are not going to increase the human resource and, of course, the infrastructure, then it is equally good we degrade these particular facilities, of course, to the levels that they qualify to be. Mr. Speaker, like whatever I'm having here, as per the auditor's report, is that we are supposed, Njoro Level sub-county level 4 hospital is supposed to have 16 medical officers. Maybe the ones that are available and in hospital was 1, and the variance was 15. Then you can try to imagine, if the qualification for it to be called a level 4 is supposed to have 15 medical officers, and of course these medical officers are supposed to directly be providing services to Anjiko, or to the patients for that matter. The work of 16 medical officers, Mr. Speaker, cannot be performed by 1 medical officer. And that is why I'm saying it is a bigger challenge. Of course, maybe honorable members can go through that particular list. You can be able to see whatever is required, whatever is present in the facility, and of course we can conclude whether this one is supposed to be a level 4 or even a level 2 hospital, Mr. Speaker. And I'm saying it is in terms of facilities and in terms of human resource. The committee had the following findings, Mr. Speaker: that the hospital was understaffed in key areas, therefore negatively affecting service delivery. Number 2, the hospital lacks equipment and infrastructure such as, and it is good to note, such as ICU beds, dialysis machines, and essential medical equipment. This deficiency negatively impact the delivery of healthcare services. Mr. Speaker, it is good to note, because of course some of us honorable members are aware of that particular facility. Some of these facilities that are supposed, this hospital serves people from far and wide, including Narok. You can try to imagine a patient coming from all the way from Narok, coming, and of course a service cannot be provided to Njoro, and then this person comes straight away to PGH. You can try to imagine, and maybe some of these patients are in critical conditions. Some of these facilities or services are supposed to be provided there in Njoro sub-county level 4 hospital, so that at least we can even try to reduce the distance in which is covered by a person who really requires these services, and of course in good time. Mr. Speaker, another finding is that the hospital lacks equipment. Oh, I had already talked about this, Mr. Speaker, and the recommendation of the committee was as follows: that the management should collaborate with the County Public Service Board to address staffing deficiencies and work with the county and the national government to procure and install the required medical equipment to meet the universal health coverage standards. And it is good, Mr. Speaker, that I can be able to see Mheshimiwa Grace Mwadhi from Bahati, who is the chairperson, Committee on Labor. Maybe it is good, maybe he or she can be inviting the department to explain some of these discrepancies that are there in terms of facilities and particularly the human resource. Mr. Speaker, another issue that was put forward by the Auditor General was the stockouts of essential medical services. Sometimes, Mr. Speaker, and the committee also noted that there comes a time when the facility, that is Njoro Level 4 Sub-County Hospital, does not have very essential drugs and medicines. In fact, almost all the year, you go there. Personally, I can witness this because, of course, I went there at some point, and there were no very basic drugs. And I think I had mentioned this, including the Panadol itself, Mr. Speaker. You are being told maybe to go outside the facility and look for a Panadol, Mr. Speaker. This is very serious, and I believe Mheshimiwa Hezi, maybe we have been in discussion with him, and of course, he is going to address that particular issue because it is a big issue, Mr. Speaker. Personally, I was told, as Mheshimiwa, because I had taken a patient there, I was told to go look for a very basic drug, maybe outside the chemist. I didn't say anything, but of course I was trying to imagine what Wanjiko is going through if, of course, some of this. And, Mr. Speaker, it is very saddening anyway. And the committee made the following findings. 1, the hospital experienced stockouts of essential medical supplies, maybe ranging from the 6th day to the very last one of the year, as indicated in the review of the hospital stock cards. Number 2, the hospital was unable to provide sufficient quantities of necessary medical supplies, which could potentially hinder the delivery of health care services. These people, the management of the hospital, of course, they need to come up with a proper way of course doing the stock change so that they can be able to know whatever is coming in, whatever is going out, so that when it is going out, they should not wait until when it runs out of stock. They keep on maybe restocking, of course, based on the need of the patients within Choro Sub-County Level 4 Hospital. Mr. Speaker, the committee made the following recommendations. One, the management should improve its budgetary process to allocate more funds for medical supplies and optimize procurement practices to avoid stockouts. Number two, the management should implement a more efficient inventory management system to ensure adequate stock levels of essential medical supplies. Number three, Mr. Speaker, management should work with NHIF to ensure reimbursement rates are aligned with the actual demand for medical supplies in the hospital. Not NHIF, I think it was a typing error, it must be KEMSA, Mr. Speaker. Number 11, in relation to this, at one point we have stockouts, Mr. Speaker, but on another instance, which was also another query by the auditors, was the expiry of the medical supplies. Of course, it is not making sense, Mr. Speaker. At one point, we have stockouts, but on another point, we have expiry of medical services. It is the issue of maybe stock taking to know what is very necessary, because if it is a matter of expiry supplies, then it means most probably when we were interrogating them, then it means some of these medicines are not required in big quantities by the patient. Then why do you go for the medicines that is not required in big quantities by the patient, and of course leave whatever is required in large quantities by the same consumers? So it is good maybe they have proper practice of stock taking to know what is required in big quantities, what is required in smaller quantities, and of course they do a balance so that we can avoid at one situation having stockouts and of course another situation having expiry of medical services. On the issue of expiry of medical supplies, Mr. Speaker, the committee made the following findings and recommendations. Findings, one, that 30,327 units of various drugs had expired, Mr. Speaker. 30,327 units of various drugs had expired, with no indication on the batch number or expiry date on the stock cards used for issuing drugs. So, Speaker, this one is very serious, Mr. Speaker. Then, number two, the expired drugs may have resulted in financial losses, and the management of the pharmaceutical inventory was found to be ineffective. And I was trying to imagine, what if, because of course you don't have that expiry batch number, what if you provide this expired drug to a patient? Then it means even more worse than even the loss of money itself. It is very serious. It is a very serious issue that needs to be addressed, Mr. Speaker. The committee made the following recommendations on the issue of expired medicine. One, management should introduce a monitoring system for tracking the expiry date of pharmaceutical and non-pharmaceutical inventory, ensuring that all items are properly documented with batch numbers and expiry dates. Number two, management should establish a clear and systematic procedure for disposing of expired drugs to prevent financial losses. And of course, maybe worse, even loss of life for that matter. Number three, management should enhance training of staff on proper management on inventory to ensure that expired stock is promptly removed and adequately accounted for. Mr. Speaker, those were some of the issues that the committee came across. Of course, we interrogated, and of course, as a committee, we gave our own findings and recommendations. That is why, again, I am appealing to the Committee on Implementation to ensure some of these recommendations that are put forward, not only by the Committee on Public Accounts, but other committees, to ensure that they are being implemented, and Mr. Speaker, being implemented on time. Because we were asking ourselves at some point as a committee, what is the need then of even making our recommendations as a committee if implementation for the same cannot take place? So I'm humbly appealing to Mheshimiwa John Mwangi from Turi, who is the chair of public implementation, to ensure these recommendations are implemented and implemented in good time, Mr. Speaker. Mr. Speaker, I take this opportunity to acknowledgements, that is, I take this opportunity to commend the members of the committee for their devotion and commitment to duty, which made the consideration of the Auditor General's report on Njoro Sub-County Level 4 Hospital successful. I also wish to thank the Office of the Speaker and the Clerk to the Assembly for the support extended to the committee in undertaking this important assignment. And Mr. Speaker, I want to confirm this before this Honourable House, that of course you have been, your office and that of the clerk has been of good help and assistance to this particular committee when we are doing our undertakings. Lastly, I wish to thank the management of Njoro Sub-County Level 4 Hospital, who submitted written responses on the report and who appeared before the committee to give further clarity to issues raised by the Auditor General. Also, maybe, I don't know whether it was an overview or what, but also I want to thank the honourable members because, of course, we cannot depend on our own knowledge as a committee. Sometimes we require input from honourable members, and Mr. Speaker, when we went for them, particularly the concerned honourable member from where this facility sits, that is Honourable Eze, maybe Honourable Anjohi, and any other honourable member who had information for the same. When we went for them, of course, they were not mean to provide information to us, and therefore, I want to thank also the honourable, this particular honourable house, and specifically the honourable members. Thank you, Mr. Speaker.
Second.
Thank you, Mr. Speaker. I want maybe request Mheshimiwa Langat from Amalo Ward to second.
Thank you, Mr. Speaker, sir. I second.
Thank you. I now propose that this House adopts the report of the Committee on County Public Accounts and Investment on the Auditor General's report on the examination of the financial statements of Njoro Level 4 Hospital for the year ended 30th June 2023, laid on the table of the Assembly on Tuesday 15th April 2025 during the morning sitting. The motion is open for debate. The Honourable Minority Leader and then the member for Maimayo.
Thank you, Mr. Speaker. Mr. Speaker, I've listened to that report made by the Public Accounts Committee and being a member of that area where that facility covers Dare, Kehingo, Maunarok, Mauche, Neswit, and Njoro itself. Mr. Speaker, it's a very worrying report. And Mr. Speaker, if you look at the members of this House, they're even worried how we survive in Njoro, if that is our referral facility. I'm also feeling for the member for Njoro. I'm sure even today he's not able to talk, if that is the situation in our facility. Mr. Speaker, if what has been mentioned here is what in the other referral facilities like in Molo, Langaranga, Kambazi, Gilgil, and Bahati, then, Mr. Speaker, we need to talk with urgency, to act with urgency, and not bring blame on the implementation committee, and we ask ourselves, where have we gone wrong? Mr. Speaker, we've stood here and we have debated issues of our facilities a number of times. Not just in Njoro. We've had reports made by the Health Committee about our facilities. And Mr. Speaker, you remember one time I said in this assembly that you can actually write a report of a facility that you have not even attended because it is similar. These are issues that are affecting our facilities. Mr. Speaker, what has shocked me most is that in Njoro, we have expired drugs, Mr. Speaker. That is very worrying. And probably, Mr. Speaker, out of the urgency that is there, there's a likelihood probably that somebody might have been given the expired drugs. And Mr. Speaker, in Njoro itself, I was talking to Honorable Hezi this morning, we have very many deaths. And Mr. Speaker, that facility does not even have a morgue itself, and we are told it is a level 4 facility. Mr. Speaker, I ask myself, probably that could be one of the cause of the deaths in our areas, because probably our people have been given expired medicine. And Mr. Speaker, that is very worrying. And I was whispering here to the Deputy Speaker, probably the people of Njoro, we might go the herbal way, because herbal medicine does not expire, Mr. Speaker. Because what we are noticing today, Mr. Speaker, is a very worrying situation. Mr. Speaker, the issue of land has been discussed, and I hope the Chair for Health was here, but it's good because the Chair for Lands is here. We need to work out on the issues of land in all our health facilities. Mr. Speaker, that land, we are not sure that it is conjoined by the Catholic Church and the county government of Nakuru, or who owns it. So we need to settle on such issues, Mr. Speaker. Mr. Speaker, the members of this assembly would agree with me. We are living by our people, and of course even ourselves, we are living by the grace of God. If that report, what I've listened, been presented by the Honorable Kamau for Kehingo, is what is in our facilities, Mr. Speaker, we need to thank God that we are alive. What our people are going through is very traumatizing, Mr. Speaker. Mr. Speaker, besides the issues of land, the shortage of staff, and if you look at the numbers that was even presented here, that a facility that's supposed to have 16 doctors has only 1 doctor. And this is a facility that is serving 6 wards, and not just wards, because we are also getting people from Narok. The Honorable Hezi will agree with me, because Narok is too close to Njoro. Therefore, Mr. Speaker, something has to be done, not just by the implementation committee, but all of us as an assembly, and ask ourselves, are we working on the right priorities? The facility that is in Njoro, the member for Kehingo has said that it has about 150 million has been pumped to that facility. There's a very big building that is going on, but currently, if you listen to the debate that was here, probably there was no need of coming up with a new facility. The 150 million that was put in that facility for construction should have been put to equip the facility that was already existent. And probably we might have gone wrong to come up, and this is not just in Njoro, because I'm reliably told when I look at the reports for this assembly, there's a big facility all over. Gilgil, there's a facility going on. Naivasha, there is a facility. The member for Maimahio is here, is always crying. There's a very big facility that is there. And are we sure that we are going to finish these facilities by the time we come to the end of our term in this assembly? Therefore, Mr. Speaker, as an assembly, when it comes to the process of broad budget making, can we ensure that we give priorities where need arises? We don't become excited and just put on buildings, and those buildings are not helping our people. 150 million, looking at that facility, because I come from Njoro, I don't think in the next 2 years we're going to finish that facility. And however you finish the facility, that will be too big, spending 200 million. There are no nurses, we have no doctors, we have no incubators, we have no emergency beds. Mr. Speaker, it's pointless. You'd rather have a small facility that's functioning than coming up with a big building that is incomplete and it's not equipped. And therefore, Mr. Speaker, I find myself today, as a member for that area, very ashamed of the report that has been read in this House. I am not sure whether to support the report or to say what, because, Mr. Speaker, supporting that report is a suicidal one, because it is killing our people. And I'm sure the members who are here, this is the same image that is in our facilities. And therefore, honorable members, when you are doing budget making, let us give priorities. Let us not build too many constructions which are not helping our people. Let us equip our facilities. Let us be very candy of what we do, because, Mr. Speaker, this is a very shameful report. However, Mr. Speaker, I support the report that has been presented by the Public Accounts Committee. Thank you, Mr. Speaker.
Thank you. The member for, now I'm seeing the Honorable Leader of Majority Party rising, so the Honorable Member for Maimayo, you come after the Leader of Majority Party.
Okay, thank you so much, Mr. Speaker. And sorry for my friend, Honorable Kamau, because he had already been given the chance. I want to submit my observation, Mr. Speaker. First of all, I want to support the report and commend the committee for the good work. I want to single out the chair of the committee for actually very articulate presentation. He has actually tried to pack up the information that is already given in the report. And that one in itself is quite encouraging. I think, Mr. Speaker, sir, it's not so surprising that we are getting such kind of reports. We've been getting reports that indicated that our facilities are not really doing very well. And mine is not to get into the details that have already been given, but I further have a recommendation that when you check on the management of most of our facilities, health facilities, they are either being manned by a nurse in charge or being manned by MOH, medical officer. And if you scrutinize very well, and I think an audit should actually be taken on these people, most of these people do not have knowledge in accounts. Administrators that are posted to these facilities also, I doubt whether they have knowledge on accounts. And that's why when a statement like there was no information or there was no vivid information on the capital assets reports, that one brings a lot of doubts on the capacity of the people who are manning those institutions. And going to the future, I really recommend that competent, knowledgeable people on accounts should actually be posted to man accounts in these hospitals. Because there is no way that somebody has been bestowed to undertake the medical services, to provide the medical services, and then at the same time, the same person again is expected to give accurate information on accounting matters. That one is a great challenge. And if we are going that direction, forever we shall continue getting these kind of reports, and we shall always be lamenting. We shall always be crying. We shall always be accusing the incompetent personnel. So my recommendation, therefore, is let the hospitals have accounting departments being manned by competent, informed individuals. Thank you.
Thank you. The member for Maimayu.
Thank you, Mr. Speaker, for also allowing me a chance to give my input. First of all, Mr. Speaker, I would like to appreciate the Committee on PAC for coming out with such a detailed report, Mr. Speaker. I was keenly listening to whatever the chair was presenting, Mr. Speaker, and I am worried, Mr. Speaker. And I also like to echo what Honorable Wajai had said, that I don't know whether I support this report or what I can say, Mr. Speaker. Because I wish the chair, in one of the recommendations, could recommend that that hospital to be closed with immediate effect, Mr. Speaker. Because, Mr. Speaker, if they are giving our patients expired medicine, Mr. Speaker, that's a criminal case. And I wish also the chair will share this report with the DCI, Mr. Speaker. I wish also this report was a report from any other county or any other country, not Nakuru, where I belong as a leader, Mr. Speaker. Because it's very shaming. Mr. Speaker, when I'm looking at this report, Mr. Speaker, it's a level 4 hospital, Mr. Speaker. And actually, as per this report, Mr. Speaker, this is a very poor health center, not a level 4 hospital, Mr. Speaker. Because if you look at the variance and the deficiency that is there in human resources, Mr. Speaker, if a level 4 hospital should have 16 medical officers, Mr. Speaker, and we have only one, Mr. Speaker, and yet we say it's a level 4 hospital with a variance of 15, Mr. Speaker, that's very wanting, Mr. Speaker. It's very wanting, Mr. Speaker. If you look at the final report of the deficiency in human resources, Mr. Speaker, in a level 4 hospital, Mr. Speaker, they are required to have 101 medical experts, Mr. Speaker, and you only have 11 with a deficiency of 90, Mr. Speaker. And yet we are saying we have a hospital. Honorable members, it's now up to us to look on what are we doing to our budget, Mr. Speaker. Are we allocating monies to where that our GICO need? Are we doing the right thing? Do we qualify ourselves to say that we are the leaders of the Nakuru County that allocates money and budgets to various needs of our people, Mr. Speaker? If we have such a hospital, Mr. Speaker, and such report being read before this House, Mr. Speaker, I'm actually surprised, Mr. Speaker. Mr. Speaker, I go further, Mr. Speaker, a River hospital should have 150 beds, Mr. Speaker. The Joro said River Hospital, Mr. Speaker, and you forgive me if I call it a very poor health center, Mr. Speaker, has only 28 beds, with a difference of almost, Mr. Speaker, almost 100 and something. Mr. Speaker, this report is very shaming. This report is very wanting. And because we have read so many reports in this House, Mr. Speaker, and in one way or the other, we are taken for a ride. Because I've never had any recommendation of this committee taken serious. And Mr. Speaker, we ask for your support. Because with such a report, Mr. Speaker, I think we have the CC, we have the CEO, we have directors and all other people in the office waiting for salary each and every month, Mr. Speaker. And such a report is being tabled before this House, Mr. Speaker. In my recommendation, Mr. Speaker, if this report is being shared with the department, I think the CEO, the CC are supposed to camp in Joro, Mr. Speaker, and to make sure that such things are not, our people are not going under such circumstances, Mr. Speaker. Mr. Speaker, I've seen that there was money allocated to do a search in building, Mr. Speaker. This is not a new issue, Mr. Speaker. And I wish also, because I've seen Honorable Kamau is doing such a report, Mr. Speaker, I wish also he do a visit in Maimayu, Mr. Speaker. Because we have a story building, Mr. Speaker, that is in Maimayu since year 2019. We allocated money last year. We allocated money this budget, Mr. Speaker, and nothing is being done. I don't know where this money are going, Mr. Speaker. I invite the committee, also the chair health, the chair public finance, and even the whole House, Mr. Speaker. Because we cannot sit here. I've tried all my reports to see what is happening in this department, Mr. Speaker. And a healthy nation is a wealthy nation, Mr. Speaker. Something, honorable members, must be done in this Department of Health. Something must be done. And if something is not done, Mr. Speaker, those people, they will cause our political suicide, Mr. Speaker. They are sacrificing us to Ajiko. The county, we allocated money, and nothing is being done, Mr. Speaker. And we have a problem with this department of health, Mr. Speaker. Because even doing BQs, Mr. Speaker, even last financial year, Mr. Speaker, I had some projects, Mr. Speaker. Even a BQ was not being done, Mr. Speaker. The money was rolled over. And our people are suffering. We have the money. We have the budget. So now we call upon the whole House, Mr. Speaker. Let us do something in this Department of Health. The department is in ICU. This department is dying. And if the health department is dying, our political career is also dying. Mr. Speaker, I'm being sacrificed even in my ward, Mr. Speaker, just because of few individuals, Mr. Speaker, who sit in allowed tables, wakizunguka na viti, doing nothing. Mr. Speaker, I'm commencing all the way from Mayo to here. And even our people are being surprised. What are you doing? What do you discuss in the floor of the House? If these reports are being tabled like that, and yet nothing is being done. Mr. Speaker, this one will not go unnoticed, and something must be done on this, Mr. Speaker. Something must be done. And I recommend you, Honorable Chair, and it's up to us now to call the department and to respond to each and every, and we immediately lower or degrade the Joro Hospital to a health center, Mr. Speaker, until we meet the standard of the Level 4 hospital, Mr. Speaker. Therefore, Mr. Speaker, I'm very much disappointed. I support the report, and I thank you, the committee on PAC. But going henceforth, Mr. Speaker, let this House take its mandate very seriously. We have the tools, we have the power, we have the Constitution. That's why we are elected by our people to be in this House. We are not elected to come and see the red carpet, Mr. Speaker. We are elected so that we can make sure that we present our people and we present them with a lot of care and with a lot of diligence, Mr. Speaker. Therefore, going henceforth, Mr. Speaker, we must do something. Something must be done. Our people are suffering. We have the money, but few individuals that want to kill the career of the governor and our career are holding our county into hostage. And if, Mr. Speaker, this will continue, I'm ready now to bring a report before this House to recommend immediate impeachment of the CC Health. If anything is not done about this, I'm ready and I'm ready. Because, Mr. Speaker, we cannot allow our county to go into this direction. Thank you, Mr. Speaker.
Thank you, the member for Maimayu. The member for Mayela, and then I will come on my left.
Honorable Speaker.
Not Mayela, but Malewa.
Yes,
Malewa West, yes.
I don't come from Malewa. Mayera, I come from Malewa. I agree. Thank you, Honorable Speaker. Yeah, the names look similar, almost similar, Honorable Speaker, and confusing, because if you look Mayera and Mayela, but we agree. Thank you. First of all, allow me to commend the good job by this committee. And I was listening very keenly, Honorable Speaker, to the chair. And I called yesterday's proceedings in the morning session, Honorable Speaker. And we recommended that we have some of the departmental and sectoral committees where we have a lot of documents that are supposed to be tabled and moved in this floor of the House. May I first of all request the Honorable Chair from Kihingo that with all the documents that are supposed to be tabled here, he might not be available in the floor of the House, maybe during the day, but he can delegate through, because we have the vice chairs and we have the other members, so that we can be busy in this House to deliberate matters to do with all these reports, Honorable Speaker. So may I urge the chair, because I remember sometimes back, the document that was tabled here, the workload on this committee, we agree, it's too big, and we need to fast track the process of tabling those documents here, so that we discuss them, Honorable Speaker, and we have the way forward. Honorable Speaker, it's very sad and bad, and this I will direct it to how those facilities are running, Honorable Speaker. So it's our mandate to know how things are being carried out within those facilities, and that's why I said the park committee has a lot of work to do. In collaboration with other committees, we are able and ready to help them to do those reports, Honorable Speaker. It's very embarrassing, Honorable Speaker, to see. Remember, we have been complaining within the county that we are running short of drugs within our facilities, health facilities, Honorable Speaker. But look at this facility that they are giving the patients in their pharmacy, Honorable Speaker, most of the drugs have expired. Why? If, Honorable Speaker, the drugs have expired, there is a process of disposing them, Honorable Speaker. Why are they putting those expired drugs in the facilities? This, as Honorable from Maimayu have said, it's illegal, Honorable Speaker. And remember, we are, according to my view, counties are mostly affected and we are targeted by other stakeholders, Honorable Speaker. We must be very keen on what we are doing on these facilities, Honorable Speaker. So I don't see why they should keep the expired drugs within our facilities, Honorable Speaker. On matters to do with understaffing, Honorable Speaker, the Department of Health, being agenda number 1 from Her Excellency, the Governor, Honorable Speaker, it has been allocated the big amount of money within the county, Honorable Speaker. And we must come and have a way forward on how we are going to do away with this issue of understaffing, Honorable Speaker. You visit a certain facility and you find a full dispensary, a very interior somewhere, Honorable Speaker, It's being learned by just a single nurse, Honorable Speaker. How? This nurse is a person, if he faces or he goes, or maybe, because sometimes it happens, he's not in the facility. The facility is being closed that day, Honorable Speaker. Surely, is that the way we are supposed, how we are supposed to learn our facilities? The facility should have a minimum of maybe 2 nurses, Honorable Speaker, of opposite gender, Honorable Speaker. So when it comes to do with matters of budgeting, we must sure, and we need a meeting with Her Excellency Governor to discuss this issue, so that we can try to eliminate this issue of understaffing from our facilities, Honorable Speaker. In all level 4s and level 5s, Honorable Speaker, I was thinking of Naivasha, which is supposed to be a level 5 hospital, but as at now, it's a level 4 hospital, Honorable Speaker. There is a big infrastructure there that was constructed by the Kengen sometimes years back, Honorable Speaker. And in this budget, I know there is a allocation of putting some equipment. It's going to be equipped. So in Naivasha, we will be lucky. And immediately, that facility is being equipped. It will be taken maybe to level 4 after all the procedures went through, Honorable Speaker. I therefore raise to support this report, knowing very well and letting the House know that we have a lot of work ahead of us that we need to do, especially when it comes to matters with all our facilities and budget making. Thank you, Honorable Speaker.
Thank you. The Honorable Member for Olkaria. Sorry for that. The Honorable Deputy Speaker, then the Honorable Member for Olkaria.
Thank you so much, Mr. Speaker. I rise to support this report. However, Mr. Speaker, I want to join my other fellow members because it shows that from the report, the Department of Health is in a state of ICU because it mirrors a lot needs to be done in our facilities. However, Mr. Speaker, I have not had the privilege to be in Joro, but I want just to say that from the table, you can see even the basic things that are supposed to be done in a level 4. Things to do with the newborn unit incubators, we don't have, we have 0. We have a newborn cots for babies, it's 0. So I wonder if this facility, we have a maternity in that facility, and it leaves a lot to be desired. So, Mr. Speaker, sir, it's high time also the national governments, according to the Constitution, health is a fully devolved function. And you find sometimes a lot of monies are being domiciled with the national government. And this is what we see. With the Universal Health Care Program, just the other day, the CS was here, and there was a likelihood or a promise that they are going to equip most of our level 4. And by this table that we see, there are a lot of equipments that are supposed to be in these hospitals, which does not qualify even to be called level 4. And I want to agree with the chairman, Kamau, that this, is it naming or baptizing hospitals to be level 4? It's just naming, but it does not equate to the whatever the services are there. It's high time the government baptize these hospitals by the level of services that are offered to our people. Because even in my ward, we have Merogi Karaoke. It's a level 4, but it requires a lot to be done. We don't have a theater, we don't have a mortuary, we don't have a dental unit, we don't have a eye unit. So from the reports that we are receiving, I want to join my brother from Maimahio and say somebody has to take responsibility on this, or as a house, we recommend for dire consequences to people who are supposed to do this. I have been having one-on-one with the chairman, Park, and I want to appreciate the work that you are doing. You have a lot that you are doing, but this mirrors the society that you are living. And Mr. Speaker, sir, just the other day we passed a budget in this honorable house, and I can say almost 36% of the money that we allocate to departments, the Department of Health take 36%. So we need to get value for money, and somebody has to take responsibility in what we are supposed to get. With those few remarks, I want to support this report and say that action has to be taken. Thank you, Mr. Speaker.
Thank you. The Honourable Member for Olkaria, then the Honourable Member for Kapkures, in that order.
Thank you, Mr. Speaker, to allow me to contribute to this particular noble report from the Park Committee. Mr. Speaker, I'm a representative of Olkaria Ward. My name is Peter Palanga for purpose of records. I wish to contribute as follows. One, I want to appreciate the contributions and the good work done by this particular Park Committee. I listened to the chair representing the other members of the committee, and indeed you can detect within his presentation that they have done a good job, and is a very recommended job that we want to encourage. That chair and your team go on, and that's what we expect of you. Mr. Speaker, there are some very simple, basic things that are featuring in this report. When they talk of non-disclosure of properties of particular facility, it leaves a lot to think about, that the management even is not aware and they can't disclose the property they have, the assets they have within the facility. Is it by design or by default? Is it a calculated move, really, just to deprive the information to the auditors or the entities? I want to start from there by saying, when they talk of unconfirmed inventory balance, I really want to, I'm thinking loudly, to be convinced on how can we as a management fail to have the inventories of our facility. We are in management, we have been operating, and we even don't know the inventories that we are operating with. Is it possible, really? Is it a deliberate denial to present this? Mr. Speaker, based on this, I want to ask the chair that can you include the recommendation within your report that we disband with immediate effect the board of management of that facility? Because again, we must be seen to be cracking whips. It cannot be a song day in, day out. Because these are basic things. If Honorable Muraya and Palanga and Mwadi or wherever, you are given the responsibility to run that facility for a week, the first thing that we should do is really to understand what are these inventories. What is it that this facility have? You want to tell me a facility is running for 2, 3, 4 years, people are in management and they are not really aware of this? This is a joke of highest order. And Chair, for sure, we can't allow this to continue. I wish to recommend that even the appointment of these officers, Mr. Speaker, it is worth noting that we have continued to appoint our political psychophases to run important facilities. Not even boards, not even anything. I think time has come where then we require, before even we appoint the people to manage these facilities? Can we look at professionalism? Can we look at experience on how these facilities are run? Because I've seen some people being appointed, and indeed, it's only because they are political psychopathies of the management, which is not acceptable. Because by so doing, we are only servicing our people. We are demeaning our people. We are depriving the services to our people just because of the people that we want to appreciate, we want to reward in the name of political appointments. Indeed, when on the other side, they are not even competent of doing this. So I think, Mr. Speaker, honestly speaking, and without pointing a finger at any person, we must be very honest to ourselves. When it comes to appointing members even to run these facilities, who are these people are we appointing? What credentials do they have? What value do they add to those facilities? Because again, it's not only in Njoro. It's cutting across. Most of these facilities are being appointed by people who are not competent at all. Wanafikiria tu wakipewa kazi hao ni kungoja watapewa allowance, watapewa pesa, lakini hakuna jukumu walilonalo kufanyia watu kazi. Shida watu wetu wakipata, sisi ambao tumechaguliwa, ndio sisi tunaonekana hatufanyi kazi. Mr. Speaker, I think let me move from there. When we talk of facilities having expired drugs, I really don't know. Does it mean we don't have patience to go for these drugs? Whereas our people are complaining day in, day out, they don't have drugs. Where have these drugs such that now they have expired without being used? Zimekuwa zinawekwa wapi mpaka zina expire? Watu wetu wanaenda hospitalini, hakuna madawa. Wanatuma kwenda pale chemist kule nje wanunue. Wakienda kwa hospitali madawa hapo. Alafu baadaye kupatikana kuna madawa zimekuwa expired. Surely, can we read between the lines? Because some of these chemists and some of these doctors have their chemists outside there. And I'm very sure within those chemists, you cannot find these expired drugs. Sile sinakuja mzuri sinafanya kazi, I'm very sure they are finding their way to their chemists. Why is it that we have on stock the expired drugs? Why are we putting our community surely? Because there is no doubt that if these drugs are on the stocks, then there are those likelihood that these drugs are being given to the patients. So akipewa madawa zime expire. Magonjwa ende ongezeke. Wakikufa ndio wakuja kwa waheshimiwa tuende tuchange. Because they will always run to us. Because vifo ni mingi. We can have a way on how to control this. Mr. Speaker, for sure, my submission to this is unacceptable, and the members of the board and the management, if these drugs are there, we must trace where did this drug come from, when was it delivered, and why is it that these drugs have not been used until they expired on the shelves. We cannot sit back. We cannot wait. We cannot compromise this. And Mr. Chair, I wish to request that let's use this as an example. Let's use this as yardstick. Let's make sure somebody is accountable, somebody is responsible for this. Otherwise, this cannot be a song forever. It can be a walk in the park all through, just like we have been talking about it. That is unacceptable. We cannot sit back and wait that to happen. Shortages of staffs. We have talked this. It's a song. Hii ni wimbo tu ya kawaida. Tumeimba tukiwa kaunti hiyo ingine. What is it that we need to do, surely? Can we maximize the facilities that we have? Can we make sure that we have value for money? Casuals. This is another milking cow. Irregular hiring of casuals. Is it deliberate? Madam Chair for Labor. This is a deliberate move. It's a deliberate scheme for these people to siphon some money. I'm very sure even you want to trace the number of casual laborers with those facilities, you will not be given. Not that they don't have, it's a deliberate, it's a scheme, it's a conduit, it's a cartel of members. We sit back, waiting, looking at this, parroting, talking, day in, day out, nothing happens. Our term ends, we go, the other team comes in. I mean, we must crack a whip. This must come to an end. We must be given the list of all the casuals within the facilities and their payrolls and the money that have been paid. There are some circumstances where some people payments have been done and nobody has received the money, and those records are there, Mr. Chair, you know that. 2, 3, 4 months, no records of the people being paid when the money has been being paid. Mr. Speaker, I want to end this. Tunaishi Nakuru na tunajua sana. If there is a place where there is a lot of corruption, where money is being taken and given, carried into handbags to other offices, is these facilities. Are the hospitals. It is in black and white. We know how money is exchanging from one center to the other. And this thing must come, this practice must come to an end. Honorable members, may I call upon you? Ndugu zangu, tumezoeana. Tumefanya kazi vya kutosha. You can't claim hapa ati sasa wewe ni mgeni hapa. We've been here for 2 years. I think the remaining 1 year, let us at least, hata kama ni kupita na mtu mmoja wawili, waje tuonekane tuna meno tunauma. Hii mchezo tumechezewa ya kutosha. Mr. Chair, please, mimi ningependa tuanze na hii report umeleta, waje watu waende nyumbani wajue kuna watu ambao wanahitaji huduma yao. Mungu awabariki. So I support the report, Mr. Speaker.
Thank you. The Honorable Member for Kapukures.
Thank you. Thank you so much, Mr. Speaker. Before I give my input, allow me to welcome and thank the students from our neighboring county, Baringo, for taking their time to come and learn how we work in Nakuru County. Mr. Speaker, I support this report from the Committee on Public Accounts and Investment Committee. I'm a member, and as the chair has put it, that the committee have a very big workload, Mr. Speaker. I also pray that you give us more time and resources, even during the time when the House is in recess, in order to come up with more reports as the one from Njoro, Mr. Speaker. Mr. Speaker, the Njoro Level 4 Hospital, as has been reported, is just but an example of what our health facilities are. First of all, Mr. Speaker, it is very bad investing in an inpatient facility, investing 150 million, but there is no ownership in the land, Mr. Speaker. Where else we could have, the Department of Lands might have used some amount to ascertain the ownership of the land before investing so much money in that land, Mr. Speaker. Therefore, it seems as if most of our level 4 hospitals are only level 4 by names. They are only given names level 4, but the services rendered in there ni kubaya sana, Mr. Speaker. Mingi wako level ya dispensary, but jina ni level 4. Mr. Speaker, kuwa kwamba they should be having 16 medical officers and only they are having one. Ile kazi ingefanywa na watu 16, Mr. Speaker, inafanywa na mtu mmoja. Inawezekanaje? Hiyo inaweza kuwa ndio inachangia fivo ya watu wetu wengi wanakufa kwa sababu ya kukosa services. The hospital is itself sick, where else we expect mwananchi to get services from the sick hospital. Mr. Speaker, I think something must be done. As my colleague, Honorable Palanga, has put it, it seems you have been sleeping on our jobs too much. You have been here for more than two years, and it has been as if we are singing the same song. The other time was a report from another health facility, the same report of expired medicines, same reports of staff. So I think the CCM, health, and all who are supposed to see that the services are rendered properly in our medical services should take
necessary actions before we get to their offices and crack the whip. Mr. Speaker, this time, I think, honorable members, let us do our mandate. It is not witch hunting. It is only that we were given this job by the Wanjiko, and we should make sure that they get proper services. Thank you, Mr. Speaker. I support the report.
Thank you. The Honorable Kezia Okumu. And then I will go on my right.
Thank you, Mr. Speaker, sir. My name is Kezia Okumu, nominated MCA from Kaptembwa Ward and a member of Park Committee. Mr. Speaker, sir, as a member of Park Committee, we are so much disappointed. We bring in our recommendations, but there is no action which is being taken. Sometimes when we go for fact-finding in these hospitals, we find there are no doctors there. The patients are queuing, and when the in charge there realizes that we are around, is when he starts calling the nurses to come running. I feel like our Department for Health has let us down. People are being frustrated in that department. Most of our hospitals are very dirty. If you go there, you wonder if they are treating patients or they are collecting garbages. There are no workers in those hospitals. And while we are, during our budgetary time, we find that we have budget for health. So what we are asking ourselves, where does this money go to? Because the way our hospitals are, level 4s should be taken back to level 3. They don't qualify at all to be called level 4s. So as Park Community, as Park Department, as Park Committee, we are disappointed, Mr. Speaker, sir, and we feel it is high time we as oversight honorables, we should crack the whip. We should do something. If it is the CC who is sleeping on the job, whoever is sleeping on the job, I think we should show them something. They should go home so that we get competent CCs and CEOs. Otherwise, our hospitals are in the ICU. They are dying. And we have to be serious. Thank you, Mr. Speaker, sir.
Thank you. The Honorable Lois Kagesha, then the Honorable Member for Barut, then lastly, the Honorable Member for Viwandani, in that order.
Thank you, Mr. Speaker, sir, for allowing me this time to make my submission towards this report. And I start by commending the Park Committee led by their chair. I have seen them being a very hard-working committee, always burning the midnight oil to do their oversight work, even when when most of us are out there for our holidays. Mr. Speaker, sir, I have concerns for some issues that have been raised in this report, and one of them is the fact that we are upgrading our hospitals to level 4 when they are not able to offer services that are supposed to be offered there. You know, that is lying to our Wanjiko, the people we serve. It is pointless for the people of Njoro, for example, to think that they have a referral hospital where in actual sense they do not. You know, can you imagine somebody who is at the farthest corner of Njoro has visited a dispensary, and then they are referred to Njoro, which is supposed to be their referral hospital, and then they go there, they cannot be offered services, and then they have to be referred to the PGH. Why are we being deceptive? That hospital in Joro actually is not a level 4. The chair Park said that some of these hospitals are supposed to be level 1 or even level 2. Let us give these titles to our hospitals as the titles that they deserve. I propose that before a hospital is upgraded to whatever level, I think it is important that vetting is first done, not by politicians, but by professionals, so that we can have hospitals, if they are called level 4 hospitals, they are able to offer such services, and therefore we are not politicizing health services in our county. Mr. Speaker, sir, as a member of Finance Committee, we have visited some of these hospitals in our oversight work as far as matters FIF is concerned. And we have realized that some of the reasons why these hospitals are not able to buy equipment, they have no machines, is because the FIF, which is supposed to buy equipment for the hospitals, buy machines for these hospitals, is the same fund which is being used to pay employees. And I want to think that that has the issue to do with the Act, if not the Act, the regulations that are there for FIF. So my recommendation or my request, probably to the Health Committee, the Finance Committee, and probably the Committee on Rules and Delegated Legislation, together with the Department of Health and Finance, maybe they should relook into these regulations that are meant to manage FIF and probably remove some of the burden from the FIF. Maybe Treasury should now seek to begin to pay employees so that FIF can be used for the rightful purposes. Because I do not see why we should call for employment of medical specialists while the equipment are not there. For example, why employ an oncologist to serve in a particular hospital when you do not have equipment for the same purpose? So I think the FIF should mandatory be used to equip hospitals before you even think of using the same fund to pay employees. So the relevant committees and the departments should actually now begin to think broader than we are doing today and begin to relook into some of these regulations, particularly those on FIF fund. Again, Mr. Speaker, sir, it surprises me to hear that we have expired drugs in some of these hospitals. When again we are doing our oversight work as Finance Committee, we question the issue of drugs, and some of these hospital managements, they tell us that they do not have enough money to buy drugs because of the ceilings set by the health department. Yet when you go to the same hospitals, now we are hearing they're expired drugs. So I think here the issue, the big issue here in the House is the question of priorities. Why can't the hospital management sit down and think of buying medicines based on the demand? Which medicines are demanded most? And they buy those ones. And those ones that maybe are not, that do not move very fast, they buy less. Because it beats logic. You are complaining on one hand, like we went to one of those sub-county hospitals and you were told that they require like about 2 million to buy drugs in a financial year, but the ceiling set is 600,000. And then they are complaining the money is not enough. Yet you go there, they are expired drugs. I think it's the high time this hospital management are served by professionals who are able to sit down and set priorities when it comes to buying of drugs. And again, Mr. Speaker, sir, as a mother, I also want to address the issue of maternity in Joro Sub-County Hospital. I'm wondering, even when I'm seated here, I can't imagine a whole sub-county hospital, a level hospital, 4 hospital, that has no maternity services. That somebody or an expectant mother who develops complications and is coming from the farthest part of Njoro cannot be catered for in the Njoro level 4 hospital. They have to come all the way to the PGH. That is doing a lot of disservice to the women of this county. And I think if there is something that needs to be looked at as soon as possible, maybe even the MCA for Njoro can set aside some funds to set up a maternity wing at the Njoro level 4 hospital. Otherwise, I always say that giving birth sometimes is associated with a lot of complications. It's not just like going to a hospital and you cough and the baby comes out. We must take care of these mothers, because when you are giving birth, we are perpetuating the life of our community. And finally, matters record keeping as far as financial statements are concerned in most of these hospitals. Like I have said, Mr. Speaker, sir, the Finance Committee has visited some of these hospitals. Our mandate is not even to look at the expenditure of the funds. That is not our mandate. But we look at the flow of the revenue from the collection point to the treasury. And when we look at some of these records to the hospitals that we have visited, we have seen that the collection and the transactions are not telling. And so we are always left with 2 questions unanswered. Is it a question of poor record keeping by the accountant who could be incompetent, or do we have thefts of funds in those hospitals? Why are we having collection not tallying transactions or even tallying reimbursements? What are the issues? So it's the high time that these management boards are vetted and we ensure that there is proper flow of money and proper usage of money in these hospitals, not just in Njoro, but in almost all the hospitals that we have seen the issues of financial statements. They never tally. Otherwise, thank you, Mr. Speaker, sir, for giving me this chance.
The Honourable Member for Barut, and then the Honourable Member for Viwandani.
Thank you very much, Mr. Speaker, for this opportunity. I rise to support this report. Mr. Speaker, but on the other hand, I would like to support or like to agree with my fellow colleagues that this Njoro Level 4 hospital is not supposed to be a Level 4 hospital, Mr. Speaker. Mr. Speaker, this hospital is supposed to have necessary equipment. Mr. Speaker, this hospital is supposed to have 5 ICU beds, but they have none, Mr. Speaker. This hospital is supposed to have 5 renal units with at least 5 dialysis machines, Mr. Speaker, but they lack, they have none, Mr. Speaker. They also supposed to have 5 newborn units, incubators, but they also have none, Mr. Speaker. So I think this hospital is supposed to be dropped, to be a level 2 hospital or a dispensary, Mr. Speaker, because they lack necessary equipment. So, Mr. Speaker, being a member of the PAC committee, during our interrogation, I've heard Mheshimiwa from Maimayo talking about the closure. The committee should have recommended for the closure of the facility. But I would like to inform the House that we gave them the stern warning that if the same report reoccur in our next report, Mr. Speaker, we are going to give harsh recommendation, including dropping that hospital from level 4 to a level 2 hospital, Mr. Speaker. Finally, Mr. Speaker, I would like also to urge my fellow colleagues from this House to support this report and pass it so that we can allow or give way for implementation committee to ensure all the recommendations that are in this report, Mr. Speaker, to be recommended fully, Mr. Speaker. Thank you for giving me this opportunity. I support the report.
Thank you. The we are almost coming to an end of the time that we sit, and I haven't seen anybody moving that we extend time. So I will allow the honorable member for Viwandani 2 minutes, the honorable member for Mayela, the honorable member for Bahati, and then the chair will respond. So 2 minutes, so that we are on time. The honorable member for Elementator.
Honorable Speaker, I wanted to seek information from Honorable Royce because I think she misled the House by saying that Njoro Level 4 Hospital does not have a maternity. But looking at the report, I can see that there is a maternity. I wanted to seek clarity from her because I also have a friend, a lady, who told me that she gave birth from the same facility. So for the sake of clarity, maybe the members who went to that facility can clarify to this House. Thank you.
The Honorable Lois, you will respond to the Honorable member for Elementator in 1 minute.
Oh, thank you, Mr. Speaker, sir. I think the Honorable Nene is correct. What I meant to say is about the theatre services for that maternity. And that is why I talked about a woman traveling all the way from Mount Narok with medical complications, and they have to be referred to PGH. That's what I meant. Okay. Thank you.
Thank you, the Honorable Lois. The Honorable member for Viwandani, and then the chair will respond.
Asante sana Mheshimiwa Spika, na mimi kama mwanachama wa kamati hii ningependa sana kusema ni shukrani kwa kutupatia nafasi hii na kwa kutuwezesha kufanya kazi ambayo inafaa tufanye. Lakini Mheshimiwa Spika, hata kama naunga mkono hii ripoti, ni kwamba tumekuwa na ripoti nyingi sana katika hii bunge ambazo zimekuja mbele zetu, iwe ni kwa kamati ya park, ya afya, ya mashamba, kila kamati imekuja hapa. Na kwa kusema kweli Mheshimiwa Spika, hakuna kamati ishawahi leta ripoti hapa ikasema ya kwamba any department iko na stakabadhi za kurithi ama kuwa ndio yenye hii ardhi katika hii kaunti ya Nakuru. Na sio kwamba ni kwa hii miaka 2 ambayo tumekuwa hapa. Miaka 10 imepita, miaka 2.5 tumekuwa hapa, tumejadili maneno ya hati miliki ya ardhi, lakini hakuna department yenye iko na hati miliki. Kwa hivyo serikali imekuwa ikifanya maendeleo kwa shamba ambayo hata saa hii wenyewe akiamka atufukuze, hakuna kitu tutamuuliza. Nilisimama hapa Mheshimiwa Spika, mara nyingine nikasema ya kwamba Naivasha level 4 it's divided into plots, na tukapitisha hiyo sheria hapa sisi wote, tukapatia implementation committee. Lakini nataka niwaambie hawa wabunge wako hapa, kuna kitu ambacho kinatunyanyasa, kinatufanya tukue watu ambao hawana nguvu, kwa sababu hawa watu wote kamati zingine niseme na niruhusiwe niseme tu, wameenda kulala na executive huko. Kwa hivyo hata ukimwambia tufanye hii, yeye ako huko na executive wanafanya mambo zao, hawana shughuli ya maneno ambayo tumepitisha hapa. Na kama Mheshimiwa Okumu angekuwa pale, ningemwambia ukiangalia katika hii bunge saa hii, Mheshimiwa Spika, uangalie idadi ya wabunge ambao wako hapa ni wachache sana na wenye wanajadili, lakini kuna mjadala unaweza kuja ukute hata kama mtu hajawahi ingia kwa hii bunge, aliingia kiapisho hapo, hako hapa amejaza hii bunge, kwa sababu yeye hako hapa kwa sababu ya kuhudumia mwananchi. Ako hapa kwa sababu kuna certain power ambayo ilimuleta hapa. Na mimi nataka kusema ukweli, hata leo mimi nikisupport hii juu tumefanya hii yote na hiyo machungu tuko nayo, hakuna kitu itafanyika. Implementation chair is not here, na anajua kuna biashara kwa bunge ndio apewe. Hata ukimpatia, niliuliza yeye how far amefanya implementation, na Mheshimiwa Speaker, wewe ulimpatia 60 days, hata waleo hajanirudia tujue the progress. So hata kama nimesimama hapa leo saa hii na ninaongea, ninasema ya kwamba tutapitisha hii mswada, hakuna mtu atapinga, lakini kama hatutakuwa sisi binafsi, we be ourselves, ya kwamba hakuna kitu itafanyika. Kazi tumefanya, chairman, tumefanya kazi ngumu, tumetembea, by the way we've given ourselves. Hata wakati wengine wanafanya biashara zao na maneno yao, sisi tumejituma. Natoka all the way from Naivasha ninaenda Joro, na waita wanakuja Naivasha, tunaenda. Lakini ukweli wa mambo ni kwamba katika hili bunge, unless we come back to our senses, tujue. Na mimi wacha tusiseme ati tunataka kufukuza sijui waziri fulani, tunataka kufukuza management fulani. Let me ask you, unawezaje chagua na umpe kazi ya management ya hospitali wakili ambaye hajui maneno ya medicine, alafu uniambie ataenda kufuatilia maneno ya ardhi, iko na stakabadhi, madawa yenye ime-expire, na yeye ni wakili. Lakini kwa sababu yeye aliunga mtu fulani mkono, anapewa kazi. So tunadunisha hadhi na maneno na mambo ya afya katika kaunti yetu, na si tu ya afya. Ukienda kwa mashamba, ukienda kwa masomo. Jana Mheshimiwa Speaker, kulikuwa na mjadala hapa kuhusu maneno ya masomo. Mtu amekatalia checks hapo, hajui watoto wako kwa ofisi za waheshimiwa, wazazi wako hapo, kwa sababu yeye hajui ni nini hiyo inafanyika. So mimi nataka kuambia wabunge na waheshimiwa hawa wako hapa, kindly can we come back to our senses, tujue ni nini tunafaa kufanya. Wacha niwaambie leo hii,
Honorable Muraya, have your 2 minutes. The time for
Yes.
this plenary sitting is almost.
naomba tu Mheshimiwa Speaker uniongeze muda wa dakika moja. Sasa naomba hivi, waheshimiwa tulio hapa, tafadhalini, can we come back to our senses, na tukipitisha hii mswada, tafadhalini tujaribu kufanya kitu, na tukitoka hapa nje isikue ya kwamba ni mimi nilikuwa ninasema, ni mimi nilikuwa ninaongoza. Can we crack our whip, ndio tujue ya kwamba ni nani amekosea, ni nani amezembea katika kazi. Hiyo ndio tu inaweza kutufanya. Tumepitisha miswada mingi, lakini hakuna matokeo ambayo tunayaona. Nikijaribu kusaidia Mheshimiwa Royce, wewe unaambiwa kuna maternity Njoro, lakini ni maternity imeandikwa jina, but services, you know, maternity is services. Kweli ama si kweli? Lakini ukiandika hapa assembly na ikuwe hakuna watu wako hapa ndani, hakuna assembly. So maternity the same case, ukiandika hapo maternity lazima kukuwe na services. Mtu hawezi toka Maunara ukakuja Joro na amekuwa referred to Joro level 4 akuje akute hakuna services. Hiyo sio maternity. So Mheshimiwa Nene, hiyo ninaweza kukuambia hospitali ziko na maternity lakini ni kwa majina, sio kwa maternity ni services. Asante Mheshimiwa Speaker.
Thank you. I will really pray and request our two honorable members, the honorable member from Mayela and honorable member from Bahati, to you find time for the next session. You'll be the first one to talk. Maybe it's going to be on a different matter, but now allow the chair to have 3 minutes to respond, a maximum of 3 minutes, a maximum.
Point of information, Mr. Speaker. Before, I'll just speak for 1 minute. And I want it to be included in the response, please. In this document that
order. The honorable member for Mayela, you are allocating yourself time.
Yeah, a minute, Mr. Speaker. I'll not just, I want him to include it in the response.
So
please.
The honorable chair for the Committee on Park, have you sit near to the table. And the honorable member, I do not anticipate to cut you. So if you
I'll be very precise.
You go beyond 1 minute, I'll cut you.
Mr. Speaker, sir.
Yeah.
There is a statement in this document that talks about a consent that was given by the Catholic Diocese. In the lands department, we know what a consent means. It means that somebody has been allowed to go on and process land. So if we don't have documents for Njoro, it's not a problem of the Catholic Church. It is a problem of ourselves, and we should up our game. Let us get these titles as quickly as possible, because the Catholic Diocese that we are claiming holds this land has already given a consent. Thank you, Mr. Speaker, sir.
Thank you, the honorable member for Mayela. The honorable chair, you have your maximum now 2 minutes. You wrap up.
Thank you, Mr. Speaker. I think I'm not even going to take 3 minutes. I'm going to take a maximum of 1.5 hours, because, sorry, Mr. Speaker, 1.5 minutes. 1.5 minutes. This discussion is becoming sweeter by the day. That is why maybe I'm allocating myself even more time, because even we can discuss this even from now up to evening. But Mr. Speaker, having listened to the honorable members, that is why I said in my submission that I thank the honorable members. You have heard, Mr. Speaker, the input that the honorable members are having towards this discussion. Though they are not, some of them are not members of the Public Accounts and Investment Committee, but of course the input they have, of course, is very valid. And this is the kind of submission that we require in the committee. So I want to put it very clear, very short and clear, Mr. Speaker, that I want to agree with whatever all these honorable members have said. For the interest of time, I want to agree with all what the honorable members are saying. Right from Muraya, Mheshimiwa Royce, Mheshimiwa Palanga, Mheshimiwa the Deputy Speaker, Mheshimiwa Kirui, Mheshimiwa Muraya, and Mheshimiwa Muraya from Viwandani. I want to tell you this. Don't be surprised. Don't be intimidated. Don't be cowed. As long as you are doing your oversight job, whoever is going to say whatever outside,
address the chair.
The speaker, Mr. Speaker, please. I wanted to tell Mheshimiwa Muraya he should not be cowed down as long as he is doing his oversight job. Maybe the only honorable member I want to differ with slightly, but of course to a greater extent, agreeing with whatever he said, is Mheshimiwa Kamau from my Mahio, Mr. Speaker, of saying that we should completely close these facilities. Maybe I want to disagree with him and I tell Mheshimiwa Kamau from my Mahio, it is even better to have that one medical officer, because that one medical officer, Mr. Speaker, though we know there is very great variance or discrepancies in terms of human resource, but it is good to have one than even to have none, because this medical officer is going to be providing services, though in a smaller scale, but of course is assisting Wanjiko. We should have even that one than having none, because if we have none, then no service completely to that particular facility. But of course, listen to even what Mheshimiwa Palanga said. Listening to what Mheshimiwa Murai is saying and other honorable members.
The Honorable Chair.
Yes, Mr. Speaker. So me, I want to agree with my fellow honorable members that of course we should try as much as possible. The relevant departments, we should try as much as possible to implement whatever we did as a committee. Thank you, Mr. Speaker, sir.
Thank you, the Honorable Chair, members. I will now put it to question the motion that is this House adopts the report of the Committee on County Public Accounts and Investment on the Auditor General's report on the examination of the financial statements of Joro Level 4 Hospital for the year ended 30th June 2023, laid on the table of the Assembly on Tuesday, 15th April 2025 during the morning sitting. As many who are of that opinion say aye. Aye. As many who are of contrary opinion say nay. The ayes have it. Next order.
Mr. Speaker, sir, those are the orders of the morning sitting.
Honorable members, this House is adjourned to today, 2:30 p.m. Thank you.